Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
Cystic fibrosis is the most common fatal genetic disease in Canada. It occurs in about 1 out of every 2,500 births, which is very common.
Yeah.
But for CF Awareness Month, Health Specialist Leah Sarich tells us patients are living longer with less disability than ever before. This is
Isn't that good news?
Yeah,
It's really exciting. So as you mentioned, there's no cure for cystic fibrosis, but as you said, patients are living longer and better. So this is great news, and mostly because CF is detected right away now. So as part of the newborn screening program, they're looking for CF as well. So this is really helpful because then they can intervene early and help these children grow with the disease and learn how to manage it from a very early age. And then the therapies can be started as well. So what is CF exactly? It's a genetic disorder, so that's an inherited disease, and it basically causes problems primarily in the lungs and the digestion system.
A secretory problem, but it involves mainly the pancreas and the lungs. The lungs are the general manifestation throughout most of their lives. They develop chronic lung infections, and that's how our interest has developed, looking at chronic suppurative lower respiratory tract infections. But from birth on, the other major problem is digestion. Due to the gene defect, they don't digest fat in their diet and they become malnourished.
So when these patients get sick, they end up with these chronic lung infections. So they've got that heavy mucus, they've got a cough, they've got shortness of breath, fever, that kind of thing. They also have the digestion problems, so they can't digest the fat properly. So children with CF often have problems with growth and development, things like that. But Dr. Rabin says most of these patients are doing very well. So for example, for the lung infections, they're treated with IV antibiotics either at home or in the hospital. The GI problems are looked after with enzymes taken at every meal and snack. And Dr. Rabin says you wouldn't even really know that someone has CF these days unless you looked at that collection of pills that they take every day or if they were sick. So patients used to only live into their teens, but now they're living well into their 50s and 60s, even a little bit longer, And Dr. Rabin says new medications are coming out all the time. In fact, there's a new, what he actually calls breakthrough, and we don't use that word lightly in medical land, breakthrough medication in Alberta that just came out a couple of years ago that's making a big difference in some of these patients.
It's a new medication that corrects the gene defect, but it only does so for about 5% of the population so far who have this one specific gene mutation. And what we know in the past few years since this discovery and the publication of the results, we now know that we're going to get other medications that have a similar ilk that will then correct the gene defect in the majority of our CF patients. So there's tremendous promise for really effective therapy.
Yeah, tremendous promise. So again, that medication is working for only about 5% of the CF patients. But what it points to is that similar medications that work the same way, that'll work for the majority of the patients, are certainly on the horizon. So they're certainly coming. Also making a really big difference for these patients are the specialized CF clinics that you'll see in major centers around the country. So these clinics use a multidisciplinary approach to treat these patients. So they're going to go and they're going to see a doctor, a nurse, a respiratory therapist, a physiotherapist, a pharmacist, a social worker, etc., etc. So they're getting that multidisciplinary care in one location, which is really, really helpful for the patients. And of course, these clinics are all supported by CF Canada.
And we want to lend our support to some R&D when it comes to CF. So tell us about what's happening this weekend.
That's right. So these clinics, as I mentioned, supported by CF Canada, and so they've got a big walk this weekend. It is at North Glenmore Park. It's on Sunday at noon. And again, you want to get out there and support them. Of course, all that information will be on my blog, where to go and what to do, because of course it's that organization that's funding these clinics that are helping all of these patients.
BreakfastTelevision.ca is the way to find Leah's blog and that information. Health Specialist Leah Sarich, thank you very much for this.
You're very welcome.